The promise of a new life. You'll hear many parents say it doesn't matter if they have a boy or a girl as long as their baby is healthy. But nothing can prepare them for the shock of discovering something's wrong with their unborn baby's heart.
About 40,000 babies are born in the United States each year with a congenital heart defect, and 1 in 4 of those infants will have a defect so critical they generally need surgery in the first year of life.
Regardless of the severity of the baby's heart condition, pediatric cardiologists say the news can be difficult for parents to grasp.
It's pretty stressful. Whether it's their first child or their third or fourth child, it's still a very difficult conversation to have. Most people don't understand these defects, but whenever you start talking about the heart, everybody's worried about it, rightly so. Complex things can be really tough on families.
For one family in North Carolina, doctors found a problem with their baby's heart before he was born.
Owen Monroe was so sick, he wasn't expected to live long enough to undergo a traditional heart transplant. So one of his doctors attempted an innovative surgery in hopes of saving Owen's life. Owen Monroe is a toddler who is all heart.
Too bright. No, look good.
He loves to be outside. He loves bath time. He's starting to love the pool, which is exciting.
His parents, Taylor and Nick, have big dreams for their little guy.
Really, he's gonna be an engineer. He's just practicing now.
But Owen's future didn't always seem this optimistic. In 2022, before he came into the world, doctors discovered a problem during a routine ultrasound.
I was 20 weeks pregnant and we were getting my anatomy scan. We thought everything was normal. We had a couple people come in during that scan, and I knew, just because I'm a healthcare professional, that the more people that come into my room during the scan, it's probably not good news.
Taylor's assessment was right. The outlook for her unborn son was not good.
We think that it might be a congenital heart defect called truncus arteriosus. It is 1 in 33,000, so it's very rare.
Truncus arteriosus is a life-threatening condition that creates one large blood vessel leading out of the heart instead of 2 smaller ones. Having only one large blood vessel means the oxygen-poor and oxygen-rich blood mix, which reduces the amount of oxygen delivered to the body. Babies born with this condition usually experience heart failure within the first few weeks of life. As for Owen, the Monroes were told he would need several major heart surgeries before he reached puberty, and Taylor's labor would need to be induced at 39 weeks because of his condition.
He was born just before midnight on April 5th. We got to hold him for maybe 5-10 minutes, if that, before they had to whisk him away to the pediatric intensive care unit.
The Monroes knew Owen would need his first heart surgery within days, but just hours after his birth, Nick received another gut punch.
One of the doctors just comes up to me randomly and is like, oh, he's going to need a full heart transplant. And so that was the first time I heard about it.
8 hours after he was
8
born.
hours after he was born.
Owen was immediately placed on the transplant list. The doctors we spoke to say it can take up to 6 months before a newborn gets a new heart. But
Owen didn't have that time. He had what we thought was maybe a couple weeks.
Dr. Joseph Turek is the chief of pediatric heart surgery at Duke University Medical Center in Durham, North Carolina. Dr. Turek knew Owen's prognosis was grim and suggested a revolutionary approach to save his life.
So what we do is we take a heart that has been donated that's not going to be used for a full heart transplant, and we take the valves from that heart.
That innovation is called a partial heart transplant. Dr. Turek had never performed the procedure on an infant, but he was ready to head into uncharted territory with Owen.
They were brave about this and said, if this is his best chance and also this can help other children, let's do it.
Then I asked, how many times have you done this before? And he said, I've done it on 5 piglets, and the pigs are doing great.
Dr. Turek says the ultimate goal of the partial heart transplant is to have the implanted valve grow along with the child.
Once a valve is too small for you, it's not going to do the job that you need it to do.
Dr. Les Hickson is a pediatric cardiologist in Baton Rouge, Louisiana, who did not treat Owen. Dr. Hickson echoes Dr. Turek, explaining infants and children who undergo traditional valve replacement surgery endure multiple grueling procedures.
Each one of those surgeries carries risk. And then certainly the more you go into a patient's chest for surgery, there's more scarring, and so it makes the surgeries down the road even more complicated for the surgeons.
At just 5 pounds and less than 3 weeks old, Owen underwent the 8-hour surgery to repair his tiny heart.
When he opened Owen up and looked at his heart, it was way worse than he expected. Like he thought that would have more time, but Owen probably had like maybe 10 days left by the time he had the surgery, because his heart had enlarged that much.
Good job.
Good job.
Good job.
But Owen defied expectations. He recovered from the surgery and was allowed to leave the hospital 7 weeks later.
Oh, there you go. There's some eyes.
In the following months, his checkups showed his heart was functioning well and his heart valves weren't leaking.
Yeah.
The Monroes are forever grateful to Dr. Turek, who they consider a member of their family.
We don't really call him Dr. Turek. We should, but he's Uncle Joe to us.
And Dr. Turek sees Owen as more than just a patient.
I actually zoomed in on his during his first birthday party. We're forever bonded.
Owen has very few physical reminders of the pioneering surgery that saved his life. He takes an immunosuppressant drug, but his doctors say there's a chance down the road he'll no longer need it. In the meantime, Owen's parents continue to watch him grow and thrive.
I just really think he just knows he got a second chance and he's really happy to just be alive. That's so cliche and cheesy to say, but honestly, like, he's such a good kid.
The Monroes say they have another family who made the selfless decision to donate their child's organs to thank for Owen's second chance.
As of August 2024, there have been more than 15 partial heart transplants performed in the world, with a majority done at Duke.
Dr. Turek says the partial heart transplant paved the way for another procedure called a domino heart transplant. That's where one heart is able to save 2 lives.
During a domino heart transplant, a patient who has healthy valves but is in need of a stronger heart muscle receives a full heart transplant. Their healthy valves are then donated to another patient in need, creating a domino effect.